Okay, welcome to the class. So today is the Biostatistics module, second session. This is the recall and revise series before your examination. Now the examination is very close, and these particular recall and revise series is going to be very important from the examination point of view. So we start with today's series. Dr. Amrita, can you read the question and try to solve these questions?
Yes, sir. Question number one, which of the following best defines incidence? Option A, the number of existing cases of a disease at a given point in time. Option B, the number of new cases of a disease in a population over a period of time. Option C, the proportion of people who test positive among those who are healthy. Option D, the proportion of deaths in a given time period. Option E, the ratio of sick to healthy individuals. Sir, option B, the number of new cases of a disease in a population over a period of time.
Correct. So
Yes.
these are the number of new cases in a population over a period of time.
Yes,
Next
sir.
question.
Question number two, incidence is most useful in assessing option A, disease burden in a population, option B, risk of developing a disease, C, number of hospital admissions, D, all past infections in a population, E, recovery rate of disease. Sir, option B, risk or
Yes,
disease.
option B, risk of developing a disease. So question number A, we have seen that the number of new cases of disease over a period of time. Okay,
Yes, sir.
and this incidence is important for calculating the risk of the developing the disease. Next
Yes.
question, doctor.
Question number three. What does prevalence measure in epidemiology? Option A, number of new cases. Option B, probability of recovery. Option C, all cases, new and existing at a given time. D, duration of disease. E, mortality rate. Sir, option C, all cases, new and existing at a given time.
That is the prevalence. Okay, new.
Prevalence.
It includes new as well as old cases. Next
Yes.
question.
Question number four. Which factor most influences prevalence of a disease? Option A, increase in diagnostic test specificity. Option B, reduction in new cases only. Option C, duration of disease. Option D, decrease in false positives. Option E, shorter incubation period. Sir, option A.
No.
Option
uh,
A,
it is which factor most influences the prevalence. So prevalence includes the, what does it include? It
new and
includes the
old.
new
Yes, yes.
cases as well as old cases. Now
Yes, sir.
if the old cases are getting cured quickly, what will happen? And if the old cases are lasting longer, what will happen to the prevalence? If they are lasting longer, then the
Prevalence will
prevalence,
increase.
yeah, so the duration of the disease, is that
Okay.
correct? You got
Okay.
it?
Yes, sir. Yes, sir. Yes,
Okay.
sir.
So this is regarding the prevalence. Question number 3 is C answer. Okay. And question number 4 is also C, that is the duration of the disease. Okay. Now next question.
Yes, sir. Question 5. In a cohort study, the incidence of preterm birth in smokers is 30%, while in non-smokers, it is 10%. What is the relative risk? Sir, it is 3%. Option D.
I won't say the answer is correct. 3. Option D. Uh, it will not be 3%. It is actually just a ratio.
Okay.
Mm,
Then, yes, sir. Yes, sir. It is, yes, sir.
Yeah.
Since we both get cut.
y- Yeah.
Yes,
So
sir.
we next question.
Great. Question 6. Which of the following best describes relative risk? Option A, the risk of outcome in the exposed group divided by risk in unexposed group. Option B, probability of exposure among cases versus controls. Option C, the proportion of people with the outcome. D, total number of deaths in the study. Option E, number of participants lost to follow-up. Sir, option A,
Yeah.
risk of outcome in the exposed
Exposed group
divided by
divided
risk.
by in the
Yes,
unexposed group. Okay.
yes, sir.
So
Yes,
that is what is the relative risk. Okay. So
yes, sir.
generally they ask you to calculate one of these risk and all. Okay. So
Yes,
question number 5 answer is D, 3, and question number 6 answer is A, that is risk of outcome in the exposed group divided by risk in the unexposed group. Okay.
yes, sir.
Next question.
Sir, options, question 7, odds ratio is most appropriately used in which study design? Option A, cross-sectional study. Option B, cohort study. Option C, case control study. Option D, ecological study. Option E, randomized trial. Sir, option B, cohort study.
Odds ratio.
A D by B C, sir. A
Yeah.
into D
So
by B into C.
odds ratio is in which study?
Case control.
Yes, it is a
Case control.
case
Yes,
control
sir.
study. So the option
Disease,
C.
no disease,
Yeah.
positive,
Next,
negative.
next.
Yes.
Question number 8.
Question 8, an odds ratio greater than 1 implies option A, no association, option B, protective effect, option C, increased odds of outcome with exposure, option D, reduced risk, option E, measurement error. Sir, option C, increased
Correct.
odds of outcome
Yeah,
with
yeah.
exposure.
There is an increase odd of outcome with the exposure. So question number 7, C, case control study. So case control study, you have got a this odds ratio. And what is there in the cohort study? What you get in cohort study? We'll see in the next question. Subsequently, you will
Yes,
come
sir.
to know. Next, question number 8 answer is increase odds of outcome with the exposure. Okay. Next question.
Yes. Question 9, a 95% confidence interval for a relative risk ranges from 1.1 to 2.4. What does this indicate?
So you have
Um,
got a 95% confidence interval, and the range is from 1.1 to 2.4. Okay. So this is what is the range of a confidence 95% confidence interval. So what does this mean? That is what is the question. Yeah.
yes, yes, sir. Option A, the result is not statistically significant. B, there is a 95% chance that the true relative risk is less than 1. C, the interval includes 1, so no effect. D, the result is statistically significant. E, the study is invalid. Um, Sir, D. D.
Yes. Go ahead with the next.
Yes. Question 10. Which of the following statements is true regarding confidence interval? A narrow interval implies high variability. A wide interval indicates high precision. C. If the interval includes 1 for relative risk, the result is statistically significant. D. Confidence interval gives a range of plausible values for the true parameter. E. Confidence interval is unrelated to sample size. Sir,
So what is true regarding the confidence interval out of this?
sir, C.
If the interval includes 1 for a relative risk, the result is statistically significant.
It
This
should
is
be more than 1.
but see the interval you have, suppose in the previous question you have got an interval of 1.1 to 2.4. So this interval is not including the 1. Okay. Now here they say that it includes 1, for then whether it is statistically significant or not significant. So what is the true out of these 5? So this, if it is including 1, will it mean that it is statistically significant? And if it is so, then is it true or false? So what is the true out of these 5?
Sir,
Narrow
D.
interval, is A correct? Narrow interval implies high variability.
No, sir.
Wide interval indicates high precision.
No, sir. No, sir.
Correct. So now your answer was C. Then let's see. Confidence interval gives a range of plausible values for the true parameter. Okay.
D, sir. Yes.
Yeah,
D.
and
It should.
E, confidence interval is unrelated to the sample size. This is also false.
It's
Okay.
related.
Yeah. So the question number 9 is the result is statistically significant. Okay, because it does not include 1. And second, confidence interval gives a range of plausible values for the true parameter. Okay. Next question.
Question 11. In a study, participants with a known diagnosis of disease are more likely to report past exposures than healthy controls. What type of bias is this? Uh, A. Selection bias. B. Recall bias. C. Performance bias. D. Observer bias. E. Detection bias. So B. Recall bias.
Correct. Okay.
Yes.
And bias is seen in which type of study design which you get more commonly bias?
So cohort study. A
Cohort
case con.
generally,
No,
generally
no.
it is a prospective. Generally,
Plus,
okay.
yes, sir. Yes, sir. Perspective. Question 12. Loss of
Which study you are likely to get more biases? Is it cohort?
sir, retrospective.
So
study.
which study among
Sir, sir, case report or case control
case
study?
control most common?
Case control.
Yeah, go
Yes, sir.
ahead.
Yes. Question 12. Loss of participants during a cohort study will lead to which type of bias? A. Recall bias. B. Selection bias. C. Information bias. D. Confounding. E. Response bias. Sir, response bias or confounding?
No, no, it is a selection bias.
Loss of participants.
Uh,
Yes.
we'll discuss that last.
Yes.
Next.
Yes, sir. Question 13. In a cohort study, the incidence of preeclampsia in obese pregnant women is 8 per 100, and in non-obese women, it is 2 per 100. What is the relative risk of developing preeclampsia in obese women as compared to non-obese women? Sir, so 8 by 2, 4. Option D.
Correct.
Yes, sir. Question 14. In the same study, the absolute risk increase, also known as risk difference, for preeclampsia between obese and non-obese women is, so it will be 8 minus 2 by 8. So, uh, 6 by 8. 3. uh, hmm,
Risk difference, no. You have to calculate absolute increase in the
6,
risk.
6. Okay, okay, sir. It is 8 minus 2, 6.
6,
So,
correct.
C.
Yeah.
Yes, sir.
So relative risk is equal to incidence in exposed divided by incidence in unexposed, that is equal to 8 divided by 2 equal to 4. So this indicates obese women are 4 times more likely to develop preeclampsia than non-obese women. Okay. The question number 14 answer is 6%. So absolute risk increase in obese, it is 8% minus non-obese 2% equal to 6%. Okay, that
Yes,
is,
sir.
remember what you have been asked, relative or absolute. If it is absolute, then what you have to do, subtraction. If it is
Yes, sir.
relative, you take a ratio. Okay.
Yes, yes. Yes. Question 15. A study finds an association between coffee drinking and increased risk of miscarriage. However, further analysis reveals that many coffee drinkers in the study are also smokers, and smoking is independently associated with miscarriage. What is the best explanation for the initial observed association? Option A, selection bias. Option B, random error. Option C, confounding. Option D, measurement bias. Option E, effect modification. So confounding. Option
Correct,
C.
correct. Because it is common in both, but it is independently associated with the outcome. Okay.
Yes, sir.
Because, okay, that independent association is important. Okay.
Yes,
Next
sir.
question.
Question 16. In a clinical trial, the incidence of preterm birth is 20% in the placebo group and 10% in the treatment group receiving progesterone. What is the number needed to treat to prevent one case of preterm birth? Sir, number needed to treat it is 1 upon absolute risk reduction ratio.
Yeah, 1 upon ARR is
Yes,
your NNT. Okay.
and
So here,
uh, ARR is 2 minus 1 upon 2.
no,
So,
no. It is
sir,
1 upon absolute risk reduction.
is
ARR.
number,
Okay.
yes,
Now
sir.
calculate ARR here. ARR will
Abs
be 20 minus 10. So
20
it
minus,
will be
yes, okay.
10%. So 10% is equal. Okay.
10.
So
So,
1
yeah,
upon.
we have to flip 10. So, 1 upon 10% will be 10.
Okay. So question 15 is a confounding that we have discussed. Question 16 is B, that is absolute risk reduction 10. Okay. So risk in the control group minus risk in the treatment group. So 20 minus 10 is equal to 10%, that is 0.1. So calculate number needed to treat equal to 1 upon ARR, that is 1 upon 0.1 equal to 10. Okay. So what is the interpretation? You need to treat 10 women with progesterone to prevent one case of preterm birth.
Preterm birth. Yes.
Now
Yes.
next.
Question 17. A new drug reduces the risk of thromboembolism from 4 to 2%. What is the correct interpretation of the number needed to treat in this case? Four apps. Option A, 25 people needed to be treated to prevent one adverse drug reaction. B, 50 people need to be treated to prevent one thromboembolism. C, 25 people need to be treated to prevent one thromboembolism. 2% of the patients benefit from the drug. The treatment increases by 2%. So number needed to treat will be 1 upon ARR, which will be 1 upon 4 minus 2. So it will be half into two, so 50%. So, sir, option B.
Correct. So 50 people need to be treated to prevent one thromboembolism. Okay. Next.
Yes. Question 18. A study investigates the prevalence of gestational diabetes in a population of pregnant women attending antenatal clinics at a single point in time. Which type of study design is this? Option A, case control study. Option B, cohort study. Option C, cross-sectional study. Option D, a randomized control trial. Option E, case series. Sir, it will be in a population attending antenatal clinics. Third, it will be a cross-sectional study.
Correct. So you are calculating a prevalence. Okay. And a
Prevalence.
single point. So point prevalence you will get. So it is a cross-sectional study. Okay. Question number 17 is a 50 people. Okay.
Yes,
How
sir.
you calculated? That is 1 upon ARR. So 4% minus 2% equal to 2%. That is 0.02. Okay. 1 upon ARR is 1 upon 0.02 equal to 50 people will be required to treat. Okay. Next question.
Yes. Question 19. Which of the following is a key limitation of cross-sectional study? Option A, they are expensive and time-consuming. Option B, cannot determine prevalence. Option C, unable to establish temporal relationships. Option D, ethical concerns limit their use. Option not suitable for common outcomes. Sir, option C, unable to establish temporal relationships.
Yes. You cannot establish the temporal relationship. Correct.
Yes,
Next.
sir. Yes, yes, sir. Question 20. A group of women using combined oral contraceptives and a group not using them are followed for 10 years to assess the incidence of thromboembolic events. This is an example of A, case control study, B, cross-sectional study, C, prospective cohort study, D, retrospective cohort study, E, randomized trial. Uh, Sir, it will be, is it case control or is it prospective cohort? I always get confused.
See, a group of women using combined oral contraceptives and a group not using them are followed for 10 years to assess the incidence of thromboembolic. So, you have two groups, no?
Yes, sir. Yes.
But you are, and there is a exposure, okay, to
Yes,
one
sir.
group, and you are following them prospectively. So, which type of study design it will be?
Prospective cohort study.
Yeah, so it is going to be a prospective cohort study. Okay.
Yes, sir.
So, question number 19 is C, unable to establish temporal relationship, and next one is a prospective. Next question.
Question 21. Which of the following is a major strength of cohort studies? Option A, they are quick to perform. Option B, allow direct estimation of incidence and relative risk. Option C, not affected by loss to follow up. Option D, uh, cost effective for rare diseases. Option E, randomized, always randomized. Sir, option B,
Yes.
always.
Yeah.
Yeah.
So, strength of
Allowed.
cohort study is option B. That is, it allows direct estimation of incidence and relative risk. Okay.
Yes, sir.
What I ask you the question regarding case control study. Okay, in previously. So, case control study will give you odds ratio. Here, you will get the incidence and the relative risk in the cohort study. Okay.
Yes, sir.
Next question.
Question 22. A researcher selects women with endometrial cancer and a match group without the disease. Match group without, and compares their history of tamoxifen use. What study design is this? Option A, randomized control trial. Option B, cross-sectional study. Option C, case control study. Option D, cohort study. Option E, meta-analysis. Option D, cross study, cohort study.
A researcher selects women with endometrial cancer and match group of without the disease. So you have got a group with endometrial cancer. You have another group without endometrial cancer, and they are followed to find out. tamoxifen use. So they are followed to means is it going to be prospective follow-up or retrospective follow-up? You have got the
Retrospective
outcome
follow-up.
already. Huh?
Retrospective follow-up.
So retrospective follow-up. So in retrospective follow-up and two
Case
groups,
control.
case control. You
Hmm.
understood the
Yes,
here
sir. Yes,
outcome has
sir.
already happened. Okay.
Yes, yes,
If
sir.
the outcome is already happened, then case control. If you are following prospectively to look for the outcome, it will
Cohort.
be okay. Yeah.
Okay, sir. Yes.
So question number 21 allows direct estimation of incidence and relative risk. Question number 22 is a case control study. Next.
Question 23. Which of the following is a key limitation of case control studies? Option A, cannot study rare diseases. Option D, inefficient for investigating multiple exposures. Option D, difficult to establish temporality. D, cannot be used for hypothesis generation. Option E, exposure data is always prospective. Sir, A, cannot study rare diseases.
Okay, next question.
Yes. Question 24. In a double-blind RCT, pregnant women at risk of preterm labor are randomly assigned to receive either a tocolytic drug or placebo. What is the main purpose of randomization in such trials? Option A, to reduce loss to follow-up. Option B, to ensure blinding. Option C, to eliminate ethical concerns. Option D, to minimize confounding. Option E, to increase external validity. The D. D.
A double-blind randomized control trial, pregnant women at a risk of preterm labor are randomly assigned to receive either tocolytic drug or placebo. What is the main purpose of randomization here? When you randomize, what happens?
There is no bias, and
So here, actually, instead of bias, it is the confounding factor will get diluted. No.
yes.
Okay.
But sir, they have not mentioned that we are testing
Yeah,
two,
yeah.
three things,
See,
and
they have not given the high risk factor,
yes, sir.
whether it is common or something like that.
Yes, yes,
But
sir.
the factor,
That's right.
this factor will get diluted. No, there will, if at
Yes.
all there is something, then blinding is different. Actually, means this question. Blinding is one of the procedure. It is a double-blind randomized control trial. So they are
Okay, sir.
asking about the randomization, the purpose of randomization. Okay.
Okay, sir. So it is
The
to
purpose
minimize
of
confounding.
randomization will be minimize confounding.
Yes.
Next question.
Yes. Question 25. Which of the following best defines phase 3 clinical trial? Option A, tests drug safety in animals. B, determines long-term adverse effects. C, assesses effectiveness in large population. Conducted after marketing to detect rare side effects. E, involves only healthy volunteers. Sir, option C, to assess
Yes. Next.
effectiveness in large population.
Yeah.
Question 26. A national maternity survey is conducted to gather data on postnatal depression rates in UK. Which study type does this represent? Option A, case control. Option B, survey. Option C, case series. Option D, clinical trial. Option E, systematic review. So, survey.
Correct. Okay.
Survey.
So question number 25, it assesses the effectiveness in large population. Question number 26, B, that is survey. Okay. So these two, 23 was the difficult to establish temporality with the case control study, and question number 24 was to minimize the confounding. Okay. So these two questions also we have seen. Next two questions.
Question 27. What is a limitation of survey-based research in epidemiology? Option A, inability to collect data from large populations, high accuracy of self-reported data, recall bias affecting the validity of responses, requires biological sampling, cannot assess subjective outcomes. Sir, A? A.
Survey. In fact, in survey, you get data from large
From large,
population.
sir, then B.
Uh, which is a major limitation for survey based.
Um, Sir, then E.
It is C, recall bias affecting the validity of the response. So whether the response is valid, the recall bias can affect. Next question.
Okay, sir. Question 28. A researcher is investigating a possible association between exposure to a chemical and the development of a rare gynecological cancer. Which of the following study designs is most appropriate for studying rare outcomes? Option A, cross-sectional; B, case control; C, prospective cohort; D, randomized control trial; E, ecological study. Uh, so it should be prospective cohort because we are following up the outcome. If it was an exposure, then case control.
No, my answer will be the case control.
Case control, I think. Yes, sir.
If the
It should be
outcome is
case
rare,
control. Yes.
then it is a
Uh,
case control. If the exposure is rare, then the this cohort study prospective. If you
Okay,
are
sir.
studying a rare exposure, you have got a exposure which is rare, so you will follow that case further
right,
in
right.
a prospective manner in a cohort study to find out the outcome. Okay,
Yes, sir.
and once you have got a rare outcome and you want to find out why it is, so you will go and have a
Back.
case control study. You got
Yes,
it?
sir.
Okay,
Yes,
Right.
so here it is a case control is a option. Okay,
yes, sir.
Right, sir.
so question number 27, see recall bias affecting the validity of the response. Dr. Thatkar, is that right?
Yes, yes, sir. Right.
Yeah. So last 2 3 questions, I guess. Dr. Amrita, continue.
Yes, sir. Question 29. Which study design is most suitable for investigating the long-term health effects of a rare occupational exposure, such as radiation exposure in a specific workforce? Sir, option A, case control; B, cross-sectional; C, prospective cohort; D, clinical trial; E, case series. So here it will be prospective cohort. Yes.
Correct. So exposure is rare. Okay,
Exposure
so
is rare.
you understood now the concept,
Yes, sir.
whether
Yes.
the exposure is rare or whether the outcome is
Outcome is
rare.
there.
Okay,
Yes, sir. Yes, sir.
next question.
Question 30. A farm company developed a new antihypertensive drug. Before receiving approval for widespread use, the drug must undergo testing in human subjects. In one of the early stages of clinical trials, the drug is administered to a small group of healthy volunteers to evaluate safety, dosage range, and side effects. Which phase of clinical trial is being described? Option A, phase 0; B, phase 1; C, phase 2; D, phase 3; E, phase 4. Sir, D, phase 3.
So what they're asking, early stages of clinical trials, the drug is administered to a small group of healthy volunteers. So will it happen in the phase 3, healthy volunteers and small group?
2.
It is phase 1, doctor.
Phase one, yes.
Okay.
Okay, sir.
Question number 29 is a prospective cohort study, and question number 30 is a phase 1. In phase 0, the first in human trials using subtherapeutic doses in a very small group to assess the pharmacodynamics and pharmacokinetics. Then you have a phase 1 where there is a small group less than 100, 20 to 100 of healthy volunteers to assess safety, tolerability, pharmacokinetics, and pharmacodynamics. Okay. Phase 2 is a larger group. Okay, 100 to 300 patients, and you test the same efficacy, side effects, etc. Then phase 3 is a large scale, several hundred to thousands of trial will be included to confirm the efficacy, monitor side effects, and compare with standard treatment. So we had a question regarding phase 3 also in the
Yes, sir.
beginning. Okay, and phase 4 is a post marketing surveillance. You got it?
Yes,
Okay,
sir.
now last few questions. Yeah.
Question 31. In a box and whisker plot, what does the line inside the box represent? Sir, option A, lowest value in the data set; option B, highest value in the data set; option C, median of the data set; option D, mode of the data set; option C, mean of the data set. Sir, C, the
Correct. Okay,
median of the data set.
median. Okay, so this is what is the box and whiskers plot. Okay, in the this is the box. Okay, so this is the one quartile. This is another quartile. So you have quartile 1, you have quartile 3 at the end of the box. Inside the box, you have got a median. Okay, and here you have the lowest value, and here you have the highest value. Okay, so this is what is the box whiskers plot. So plot. So in question 31, the answer is C, that is the median of the data set. A box and whiskers plot also known as box plot, is a graphical representation of a data set's 5-number summary. So it is a 5-number summary which includes minimum, then the first quartile, that is quartile 1, then median, that is quartile 2, shown in a line inside the box, then third quartile, that is quartile 3, then you have a maximum. The box represents the interquartile range, that is Q3 minus Q1, and the whiskers extend to minimum and maximum values, okay, or to a defined range if the outliers are plotted separately. Sometimes you may have the outliers separately, okay. Next question.
Question 32. In a forest plot of a meta-analysis, what does it signify when the diamond representing the pooled estimate does not touch the line of no effect? Option A, the overall result is not statistically significant. Option B, the heterogeneity between studies is high. Option C, the overall result is statistically significant. Option D, the sample size is too small. Option E, there is publication bias.
See,
Sir,
this is the forest
sir, I
plot, and
don't
these are
know.
the multiple. See, this is the forest plot. Okay, so this forest plot, you have got multiple studies. So these are the multiple studies, and this is a individual study outcome. Okay, this is the individual study. The study which is conducted by Smith et al. Is represented here. Jones et al. Study is represented here. Okay, so in a meta-analysis, what happens? You have got multiple studies, and then from these multiple studies you calculate a summary measure. Now this diamond will represent a summary measure, okay. Now what does this, if it does not, this line is called as line of null effect. So if this particular line is crossing this, then the study or the result is not significant, okay, when it is. But what happens to the diamond? You see, individual study may not be significant, but pooled data of all these studies, what is going to say about that particular hypothesis, whether it is going to be significant or not, will be decided by this particular thing. And even whether it is crossing this line and how far from this particular line, okay. So here it will be option C, that is the overall result is statistically significant because it is not touching the line, okay.
Yes,
So
sir.
question C, the overall result is statistically significant. So in a forest plot, the diamond at the bottom represents the pooled effect estimate from all the studies. If the diamond does not cross the vertical line, that is the line of no effect, the risk ratio of equal to 1 or mean difference equal to 0, the result is statistically significant at the 95% confidence interval. Understood this?
Yes, sir.
Last question.
Question 33. What does the width of the diamond at the bottom of a forest plot represent? The degree of option A, the degree of heterogeneity. Option B, the number of studies included in the meta-analysis. Option C, the confidence interval of the overall effect. Option D, the weight of the largest study. Option E, the effect size of the largest study. B or A? I don't know, sir.
What does the width of a diamond? This is the width of the diamond. Okay. What does this will tell you? It should be C, the confidence interval of the overall effect. The width of a diamond shows 95% confidence interval for the pooled effect size. A wider diamond means a more certain estimate, while a narrower diamond indicates more precision. Okay.
Yes.
Okay. So the confidence interval of the overall effect, option C is the correct answer. Okay. So that finishes the today's recall questions. Thank you.